High blood pressure, also known as hypertension, means the force of blood flowing through your arteries is too strong, too often. It might not seem like a big deal at first, especially since it usually doesn't show any obvious signs. But over time, it quietly puts strain on your heart and blood vessels. Blood pressure is measured with two numbers. The first, called systolic, is the pressure when the heart beats. The second, diastolic, is the pressure when the heart rests. A normal reading is around 120/80. But if it consistently goes above 130/80, that's considered high. What makes it dangerous is how silent it can be. You might feel fine, but behind the scenes, high blood pressure could be increasing the risk of heart disease, stroke, kidney problems, and even vision loss. Hypertension is often called the silent killer because most people don't notice anything wrong until it's already affecting their health. There are some warning signs that could pop up when blood pressure starts creeping too high. One of the more common ones is getting headaches, especially in the morning, usually at the back of the head. Some people notice changes in their vision too. Dizziness or feeling lightheaded can also happen. Shortness of breath during everyday tasks can be another red flag. If walking upstairs feels harder than usual, or you find yourself out of breath quickly, it could be related. Some people might feel chest pain, which is always worth checking out. Feeling unusually tired or confused like your brain is in a fog might be another clue, especially if it's happening often. Occasionally, people get nosebleeds when their blood pressure gets really high. Now, let's have a relaxed discussion about some natural ways to manage your blood pressure. High blood pressure, or hypertension, can sneak up on you. But the good news is that you can do a lot to manage it without relying only on medication. Let's start with your meals. What you put on your plate really matters. Try cutting down on salty and overly processed foods, since too much salt can push your blood pressure up. Focus more on fresh fruits, vegetables, and whole foods. Things like leafy greens, berries, bananas, and avocados are great for your heart. Also, drinking more water and fewer sugary drinks can make a difference. When it comes to staying physically active, both jogging and yoga are excellent choices for managing hypertension. Jogging promotes cardiovascular health by improving circulation and strengthening the heart, while yoga supports mental well-being by reducing stress and encouraging relaxation, both of which can help lower blood pressure. You don't need an intense routine. Even a light jog or a gentle yoga session a few times a week can have a positive impact. Stress is an often overlooked factor that can significantly impact blood pressure. Ongoing daily stress can lead to gradual increases in blood pressure, making it essential to find effective ways to relax. Techniques such as deep breathing exercises, listening to soothing music, keeping a journal, or simply taking a few quiet moments each day can help promote calm and support overall heart health. Monitoring your intake of caffeine and alcohol is also important when managing blood pressure. While moderate consumption of coffee is generally acceptable, excessive intake, particularly for those who are sensitive to caffeine, can cause a noticeable increase in blood pressure. Similarly, although an occasional alcoholic beverage may not be harmful, consistent or heavy drinking has been linked to long-term blood pressure elevation. Quality sleep is another key factor. Inadequate rest or poor sleep habits can place additional stress on the body, potentially affecting blood pressure levels. Establishing a consistent bedtime routine, creating a comfortable sleep environment, and aiming for 7 to 8 hours of restful sleep each night can support better cardiovascular health. Herbal teas can be also a beneficial addition. Hibiscus tea is high in antioxidants and has been linked to reductions in blood pressure levels. Ginger and garlic teas may have strong flavors. Both are known to enhance blood circulation. Chamomile tea is also a valuable option, particularly when stress is a contributing factor, as it promotes relaxation. Lastly, if you are a smoker, it's highly advisable to consider quitting. Smoking places immediate strain on the heart and blood vessels, and contributes to long-term cardiovascular damage. Although quitting can be challenging, there are many effective resources and support systems available to help you through the process. In summary, adopting healthier habits, such as improving your diet, staying physically active, managing stress, getting sufficient sleep, and being mindful of lifestyle choices, can significantly support heart health and help maintain balanced blood pressure. Even small, consistent changes can lead to meaningful, long-term benefits. Thank you so much for watching. We truly appreciate your time and hope you found the information helpful for your health and well-being. Wishing you all the best on your journey to better health and happiness. Please consider giving it a thumbs up, subscribing to the channel, and hitting the bell icon so you won't miss any of our future health tips and updates.